Hello, Wave Country. I'm John Ramsey, and welcome to Wave 3 Listens Live. I'm excited about today's show because it's all about freedom. It's about Freedom Mini Dental Implants. The freedom to smile and feel good about your smile, feel confident. The freedom to eat the foods that you love. And with us to talk more about it, it's kind of relatively new technology. We'll describe that and talk about that a little bit with Dr. Larry Stroud and Dr. Regan Ackerman, who are in charge there at Freedom Mini Dental Implants. Welcome back to the show.
Hey, good to see you. It's been a little while.
It has been a little while. Look, Dr. Stroud looks all tan.
Yeah.
Yeah, bringing sexy back with the look here. I like it.
Well, I went to the beach and something came back. I don't know what happened.
It looks fantastic. Look really hip.
Well, not as cool as you, but
no, I think you trumped me on that one. It looks good. Dr. Ackerman, good to see you as well.
Nice to see you again.
We opened up the show talking about freedom, and I do like the name freedom because when we talk about mini dental implants, it is a lot about freedom. The freedom to feel good about yourself, about your smile, to feel confident, the freedom to eat the foods that you love,
yes.
The freedom to smile in a picture and not be self-conscious.
Yep.
Self-conscious. Tell me a little bit about that, Doctor.
Yeah, so that's kind of where I came up with the freedom was. The biggest thing was freedom to smile again, freedom to eat, because we hear it all day long. Patients come in, they've had dentures and they're just miserable with them. They can't eat with them. They, feel self-conscious about going out of the house with them. So the freedom to smile and the freedom to eat again with the mini implants, that's where we kind of came up with that. So.
Yeah, I can understand. If you wear dentures, if you have a loved one who wears dentures, okay, some of the complaints that you hear, because with Freedom Mini Dental Implants, you now have the choice and you could throw away your dentures. How does that sound? What are some of the complaints that you hear? Is it all about ill-fitting? There's so many, long grocery list of complaints.
I mean, people have such frustrations with dentures. They hurt, they rub, they won't stay in good to eat. People have to put all that glue in them to keep them in.
Mm-hmm.
People hate that glue. I mean, that glue is pretty nasty. It oozes out of there. It tastes horrible. Here's the life of a denture wearer. They're embarrassed to go out. A lot of people, and I've had so many patients, they won't even leave home because they're so embarrassed about their smile. They're embarrassed to go out and eat with people because their teeth won't work right. They're afraid their teeth are going to come out. If they do go out to eat with somebody, they glue their teeth in tight. They go out to a restaurant. They're scared. They're embarrassed. They're scanning the menu. Okay, what can I possibly eat? What can I get through a meal with? And, they'll be halfway through a meal and oops, denture will come loose. They had to run up, get all their gear and their bag of their glue and their brush and go in the bathroom and sneak in the bathroom with all their stuff and clean their denture out and put new glue in it and put it back in and try to go back, and it's embarrassing, and that's the kind of life people lead, half the time people will just have their dentures in a drawer at home. And somebody will knock on the door or ring the door and they'll run around the house looking for their teeth, and and they won't go out to family get-togethers. They would never have a picture taken or smile in a picture. I remember one patient that wouldn't even go and turn down a cruise with her daughter because she was so embarrassed about her teeth. So I mean, it's truly we don't think about that because it's not even an issue for us. We could smile, we have our teeth, but I mean it's a life-changing, life-altering situation for these people, and then when you fix them and give them their smile back, it's truly like they got their life back. They can do things.
Wow. Yeah, you're changing lives for the positive, and I always like when we take a look at patients. Now, Dr. Ackerman, Golda,
yes.
She's your patient,
yes.
right?
Yeah.
So tell me a little bit about Golda.
Oh, super sweet lady, love her to death. So she came in, similar to what Dr. Stroud was saying, struggling, especially that lower denture. So yeah, and she was just struggling with eating. Couldn't go out to eat, couldn't order anything off the menu, things like that. And we'll show it later and everything. But we kind of did a snap-in denture for her with the mini implants so that her denture would stay in a lot better. And I talked to her a few weeks ago, and she was just ecstatic. And I said, what has changed since we've done your mini implants? And there she is with
she
big
looks
smile,
20 years younger.
Yes.
She does.
And just happy. And she said, I can eat celery again. She can chew up her apples again. And she's like, the best thing ever is I can order a T-bone off the menu again. So, and she's like, you know, it doesn't take me 20 minutes to try to order anymore, because like Dr. Stroud was saying, she's like, you know, I used to have to scan the menu, what can I eat, what can't I, and her, you know, choices have just expanded tremendously. So she's just super excited and super sweet lady.
Yeah,
so.
it seems to me that the emphasis for Golda was to eat the foods that she enjoys and the embarrassment, but
Yes.
you know, the ancillary effects here, and some may say it's superficial, but I say it is such a good thing. And she looks fantastic, and that's okay. I mean, confidence is a good thing. Look at the difference in the two pictures, and everything just seems a little bit more brighter, a little more positive, a little more vivid. Yes, you can see it in her eyes, exactly. And isn't that something? What a difference a nice smile will make. So let's show you. There's a couple of different procedures, and first of all, I guess if you would, Dr. Ackerman, maybe you can show us what you did for Golda.
Certainly.
If you would.
Yep. So I'll show you with this model here. So this is kind of what we call the snap-in denture with the mini implants there. If you want to, there we go. Focus on that. So yeah, kind of the process is, these are the little mini implants right here, and they're so minimally invasive, and that's one of the biggest things about the mini implants. When we place these, we're not making incisions, we're not, you know, you don't leave with stitches or anything like that. Very minimal swelling. It's like laparoscopic surgery versus, you know, being cut open, okay? That's one of the biggest advantages, is it's not major surgery, okay? But we're able to place these mini implants in, and then, you know, we have this denture, and we're able to snap the denture in.
Very tight.
Very tight.
No glue.
No glue. No glue. And it's going to keep your denture in significantly better. It can't fall out when you chew and eat, and you're not going to be embarrassed and worried about it anymore. And that can all be done in one day. You know, you come in with your denture, and then we can place these implants. You know, we don't have to put you to sleep or anything like that, and you will leave with your denture snapped in that day. And I mean, you can go to work the next day if you want. You know, minimal recovery time as well compared to the surgical implants.
Okay, that was the option that Golda chose.
Yes.
And there's another option that is just like having your own teeth. So Dr. Stroud, if you would show them the other option, please, and then we'll go to the phones, 571-5263.
Well, you know, when we started doing this stuff, John, now you're talking about how new this is, and it's still, a lot of people don't know about this. That's why we're out here talking about it. But it's been around about 20, 25 years, probably since the 90s. But you're right, a lot of people still just don't know about that. They're used to the older traditional kind of implants. So we started doing these things to hold people's lower denture in, and that worked pretty good. And then we started doing it for their upper denture, and that worked pretty good. And then we started doing it for a single tooth or a tooth here or there, and that's real quick and easy, and that worked pretty good. And then we said, oh gosh, I wonder if we can just give people all their teeth back. And so now for years, I mean, we've been doing this for years, where we can actually give them their teeth back, throw the denture away, no denture at all. And we've talked about a lot of those cases on here too, but basically what we do, I'll just show you real quick on this model, if you can zoom in here. But here's your gum. Just pretend that this is your mouth. This is your gum right here. And we put in about 10 or 12 of these mini implants, okay? Like Dr. Ackerman was saying, it's not hard. You're wide awake. There's no cutting on you. There's some little pinches where we just put some Novocaine right on these spots where I'm going to go. Make these little starter holes. The implants screw right in. The implants are all in there in about 20 minutes. In fact, as soon as the implants are in, it looks just like this. There's nothing even bleeding. So then we have these porcelain teeth made. Okay, it's like a set of porcelain teeth where, if I get my hands out of the way, where it's no denture, there's no plate, it's just the teeth. And then these teeth will cement onto the implants like this permanently. We put the implants on that day. You walk out of here, you're not wearing a denture anymore.
You get a little irrigator.
There's nothing in there's nothing in the roof of your mouth, no plate, no plastic. It's just your teeth. They stay in there solid as a rock. And you're right. We give patients a water pick irrigator and show you what to do with it as far as cleaning, and you're set. I mean, to be honest with you, the people that we do this for, there's almost nothing that needs to be done afterwards. They're pretty much just set and good to go to do their cleaning. But you know, and when you do this for somebody that's worn dentures for 35 years, and they've gone through all the frustrations like we've talked about, and all of a sudden they walk out of your office and they just have their teeth that just stay there. They never take their teeth out again. They feel the roof of their mouth, they taste their food, They're like, wow,
yeah.
they're just
tasting food.
Life is different. Let's go out and eat, and have fun, and life is different for them.
Again, that's why they call it Freedom Mini Dental Implants, giving you the freedom to eat the foods that you love, giving you the freedom to feel confident about your smile. If you have a question, 571-5263. We've got Kathy on the line. Some lines are open. If you'd like to jump in, please do so. We'll return. Dr. Ackerman is here, Dr. Stroud is here, and they will share their expertise on Wave 3 Listens Live.
For the last year, Wave 3 News and these partners have worked hard to get books into the hands of kids across this city. And thanks to you, Dolly Parton's Imagination Library of Louisville is reaching even further. Kids in these zip codes are now able to be enrolled and get a free book mailed to them every month. Visit wave3.com and look under Community to see when the Imagination Library of Louisville is coming to your neighborhood. Sponsored by Delta Dental, PNC Foundation, and other generous donors.
Freedom Mini Dental Implants. You know, that's what's great about this show is if you are not aware about mini dental implants, now you are. Can you imagine throwing away your dentures, getting rid of that bridge? Perhaps you've been missing a tooth and it really bothered you. You weren't confident in your smile. You weren't able to eat the foods that you love. That can all now be reality. It's a new life, really, with Freedom Mini Dental Implants. Let's go to the phones and field some questions. Kathy joins us now. Kathy, welcome into Wave 3 Listens Live.
Thank you.
You have a question?
Yes, I have been wearing dentures for many years, and I can't keep them in my mouth. I mean, like the doctor said, I'm very embarrassed to go anywhere because I'm always afraid they'll fall out. But my question is, since I've been wearing dentures for so long, I was just wondering about the gum shrinkage. Would I qualify for the implants with my gums being shrunk down the way they are?
So that's a great question, and we hear it all the time. That's kind of the beauty of these mini implants is that we don't have to have a lot of bone for the mini implants. So we're able to help out people all the time that have had, gum shrink or some bone loss. So, we just need some bone. We don't need a lot of bone, especially compared to the surgical implants. A lot of people have been told they weren't candidates, or they had to have bone grafts and sinus lifts and all kinds of surgeries. And a lot of times when people come to us, we're able to tell them that, you have plenty of bone that we can work with, and that's the beauty of the mini implants. They are, much smaller, so we don't have to have as much bone to work with. And I invite you, Kathy, come in for a free consult. We do free consults, and so make an appointment. We'd love to take a look and see for you.
We've had a number of questions about price and insurance, and I think it's probably on an individual basis, but basically, okay, let's first of all talk about the comparison, the old surgical way when they had to do all the grafting and waiting for the heal, and it was literally surgery. So not only is this really more effective, less pain, less recovery, well, no pain. And very, very little recovery. You can walk out with your new teeth, right? But it's also a lot less costly.
Well, and people ask this, and of course people want to know about this. And of course it costs some money. Of course it does. But compared to the older style surgical implants, it's way different. For instance, to make people's dentures stay in, denture stabilization we call it, snap-in dentures, to do that for a person, to have their denture stay up in, top and bottom, what people have had to do for the last 50 years is this procedure, surgical procedure. It was the first way that they came up with to do that, and it worked fine. You go through a lot of invasive surgery, multiple surgeries over a year or two. This procedure called all-on-4. A lot of surgery, a lot of healing time. You end up with your dentures that are kind of screwed down on your gum. This is the other surgery method that's been done for a long time. Okay, nothing wrong with it. People will spend anywhere from $30,000 to $50,000 to do that.
Hello.
To have their teeth stay in. That's the way it's been done. The mini implants come along now that we've had for 20 or 25 years or so. In one visit, once we have their dentures ready, in one visit, a person comes in. They're wide awake. We put these implants in. They leave the office in a couple of hours with their dentures snapped in. A lot of times they get in the car and they drive home themselves. There's no bleeding, okay? And it's going to cost, let me just put it this way, way less than half of that, okay? The other surgery kind of implant. So you know, I'll jokingly say to people, like we've spoke sometimes, I'll say, well, you know, if you don't want it to be easier, quicker, or cost less, you might not like these.
And let's talk about, Dr. Ackerman, the response that you get from patients. I love the feel-good stories. I mean, you're changing lives. I'm sure you get a lot of chocolates and flowers and hugs. So tell me a little bit about the patient experience and what they tell you.
Yeah, it's very rewarding. I know Dr. Stroud always says he never got hugs when he did root canals, but now we get hugs. And but yeah, that's one of the reasons I started doing this. And you know, I saw before I was doing many implants, I like a lot of other general dentists out there. I was, you know, didn't want my patients to have all their teeth taken out and do dentures, because I knew how miserable dentures were and didn't wish it upon anyone. And so, you know, you see these patients and they're just kind of limping along trying to manage what teeth they have, and they don't want to do that. But as soon as I discovered the mini implants in this route, like, it can just, you know, get rid of those infected teeth and have a much better option, and you know, and not put those people through that limping phase of trying to manage what little teeth they have and dealing with that. And it's just so rewarding to be able to change somebody's life, where they can eat what they want to do and smile. So it is fun getting hugs, and you know, and it's fun, and it's fun to see their family members come in too and tell stories about them. So it's just great.
Fantastic. Yeah, we see the before and after pictures all the time, and we've had a few of your clients call in, your patients call in, and I hesitate to call them patients because it sounds like they go through surgery, but they don't. They're clients and they're friends. And look at Golda. Look at the difference there. She looks fantastic. And you were saying, Doctor, you touched upon this. Both you are familiar with this, that it doesn't necessarily have to be the whole set of dentures, although that's something you do. But maybe you've been missing a tooth or two. Maybe you have a bridge. Now with mini dental implants, as far as you've come along, you can about handle any situation, right?
Oh yeah, there's so many situations. I mean, you know, people are just missing one tooth. It's such a simple thing. I mean, people can stop by on their lunchtime and put an implant in and then go back to work. I mean, they're not even hardly going to feel anything from one implant. It's very quick and easy. A lot of people are wearing partial plates, you know, with the wires, and the plate that comes in and out, and it might have a couple back teeth on it or something like that. That's an easy thing to do. We can put teeth in and then they're rid of those partials. I mean, people hate those partial plates with the wires and the clips, and they look kind of ugly, and you know, they hurt your other teeth, and you know, people can relate to those things. But anyway, it's pretty easy and simple to just put teeth in and then they're rid of those partial plates. So anywhere from one tooth to all your teeth, really, it can be done.
If it sounds too good to be true, I promise you it's all positive. If you'd like to have a question, and the experts will handle it, 571-5263, Freedom Mini Dental Implants. Give them a call today. We'll set up a consultation, and we'll be right back on Wave 3 Listens Live.
A message from attorney Michael Sullivan about back pain and disability benefits.
Do you suffer from chronic back or neck pain? Are you unable to work? I myself have had 2 spine surgeries. I actually understand this problem. I bet you live with some pain every day. Have you applied for Social Security disability and been denied? Does it feel like Social Security has no real idea what you live with every day? Is it hard to bend over? Hard to put on your shoes? Even painful just to stand at the sink? Does a gallon of milk suddenly feel heavy? I've handled disability cases for over 25 years. Spinal problems make up a large percentage of disability awards. I really do understand how your life has changed.
Call the law office of Michael Sullivan. Call 1-888-587-0228.
No matter what disables you, if you've been denied disability benefits, call me. I'm here to help.
Call now.
Welcome back. Freedom Mini Dental Implants. Dr. Regan Ackerman is with us, as well as Dr. Larry Stroud, and they are the two responsible for giving you a confident smile and letting you enjoy the foods that you love. If you miss them, hey, come on back. It's really simple now with Mini Dental Implants. Let's go to the phones and talk to Ramona. Ramona, welcome to the show, and good afternoon to you.
Hey, good afternoon. How are you doing today?
Doing well. You have a question?
I have a big question. I have 3 teeth in my mouth on the top. So my question is, how do you get mini implants with only 3 teeth on your far right hand upper side?
Well, Ramona, what you're probably going to do if you only have 3 teeth left, probably actually going to work out better and easier for you to just have those taken out and then replace all the upper teeth. Usually works out much better. Now, theoretically, it's maybe possible if those teeth are in great shape to just replace all the other teeth. It's probably possible to do that, but it probably would make more sense in the long run to just have all new teeth put in at the top and not have to worry about any other teeth that might go bad. So typically in a situation like that where there's only very few teeth and maybe they're not in great shape, that's usually what we do. We be rid of those and then we'll replace all the teeth. We do it all the time.
All right, Ramona, thank you so much for the call.
Question.
Let's grab another one and talk to Wanda. Wanda, welcome to the show. Good afternoon to you.
Good afternoon. I have a question. What happens if you got bad credit but you need your teeth fixed?
Aha.
That's a tough one. That's a tough one.
Probably be tough to work out some kind of payment plan.
Yeah, you know, we haven't figured out how to make this free yet. Yeah. But we do have payment plans, but you do have to qualify for these payment plans. So, you know, it's going to be a credit check and stuff. Now, a lot of times people are able to rely on some other family member, you know, mom, dad, brother, sister, whatever it is. Somebody with a good credit record will sometimes apply, do it in their name, and a lot of people actually get, you know, the financing and stuff they need that way. So that's the other possibility about dealing with that.
It's a lot less expensive than the alternative, Wanda, so I do recommend to find a friend that may help you out a little bit. Yeah, although it's not free, it's certainly a lot less expensive. I want to stress that because you've shown me some numbers, and I know really can't go over those here because, one, it's a 30-minute show, but two, it's also up to the individual, depending on exactly what they need, right? Of course.
And less time because, you know, even the surgical implant we're talking about more expensive, but a lot of times you're getting referred to a specialist and then back to your dentist and then another specialist, and you're, you know, going all over town and missing work and things like that. So it's a lot less time as well as a big advantage of the mini implants.
Yep. So we talk a lot about individual experiences. So the foods that people miss, always find this interesting because a lot of times it's steak, anything that you have to chew on. Other times it's nuts. I've heard you say that a lot, Dr. Stroud.
Peanuts.
Peanuts, is that right? What do you find to be the case, Dr. Ackerman?
I have peanuts and steaks and apples, and I had one patient, and I don't even think about it because obviously I can eat salads every day, but salads. So many people have a hard time eating salads with, you know, regular dentures or missing teeth and things like that, and they want to be able to digest their food and chew it up. So. And
sometimes I think there's a stigma that is attached to denture wears. Sometimes it's hereditary. It's not the fact that you didn't take care of your teeth. Maybe you took excellent care of your teeth. You just got a bad shape genetically. And so you need to have your teeth fixed or replaced. And this is kind of like a whole new lease on life. Do you ever have some people who've been wearing dentures so long that they've really forgotten what it's like to live normally? I mean, we take this for granted. Do you get that experience a lot?
Well, people have worn dentures for years and years. I mean, they're well aware of the fact that life ain't so good like it used to be because they're frustrated with them. You know, now it's probably been a long time. It's been a long time for them, so they probably can't really totally remember what it was like to not have to mess with those dentures and not have to put glue in there and to be able to taste your food again and not have to take your teeth in and out every day. And you know, it's probably hard for them to remember those days. But boy, they're well aware of all the frustrations they're going through with these dentures.
So, Dr. Ackerman,
then when we make the change, and they get those teeth, then they remember.
I bet they do. So I want you to vouch for him, or maybe you can either confirm or deny. He tells me he's got garbage bags full of dentures.
Oh, he does. It's true story. I actually was telling the girls the other day I want to make like a big canister of all the dentures that and make patients ditch the denture. You know how they have, you know, when you pick your dress at a wedding, you know, you say I do, like I'm gonna ditch the denture. But yeah, he's got bags full of them.
I bet that's a celebratory moment because you know, you talk about Dave Ramsey, the financial analyst, no relation by the way, and he always talks about how good it feels to cut up your credit cards and to say I'm done and I'm out of debt. I wonder how good it feels to be able to say it. I'm confident about my smile. I'm not going to deal with this glue anymore or ill-fitting dentures. I can eat what I want. I bet that's a celebratory day.
I just thought about something. And you know what they do on Dave Ramsey's show when they call in like that?
Yeah.
They celebrate. What do they do? Don't you remember?
Oh, they do a big. No, don't they do a big celebratory yell?
They yell, "Freedom!" Remember?
There we go.
Perfect.
didn't think
So
about
that's what we could do.
Yeah.
Oh, do I get a cut of the, a little marketing help here?
That was a great idea.
Freedom Mini Dental Implants. Again, now consultations. For those who are watching and perhaps they don't have a question, they're pretty clear about this is easier, this is less expensive, this is less invasive, all the above, it's all good. For those who are pretty clear about that, no questions, what do you recommend they do? What do they do, Dr. Ackerman?
Call the office, set up a consult appointment. There is absolutely no charge for the consult, and we may even take an x-ray, and there is no charge for the x-ray. Just come in, let us take a look, discuss your options, we'll go over cost, everything like that. And actually, I'm going to be at the fair tomorrow, too.
Oh, let's talk about that, yes.
I'm going to be in the Bluegrass Village with one of the health and sports wellness centers there, and I'll be doing exams, and I can do consults there, too. So if you're at the fair, come by and find me and see me, too. But always welcome to, call the office for a free consult, too.
There's a food for you, Dr. Stroud. I want to tell you all this. I was at the fair the other day. Roasted corn on the cob is delicious. Didn't need butter, didn't need salt. If it's picked at the right time, I mean, it's so flavorful. I can't imagine a denture wearer probably would struggle with that, right?
Oh,
sure.
it'd be impossible.
Yep.
It'd be impossible. For me, it was 3 pounds of chocolate fudge. Some of it was for other people.
A lot of that fair food, it would be hard to handle. There's a lot of sticky, gooey. It's good, but probably not good for a denture wearer. So once again, if you're tired of wearing your dentures, if you say, you know what, I don't want to go through all the surgery and, all the cutting open and all that, this is it's really non-invasive. Very little, like you said, very little bleeding, very little pain. And are patients amazed sometimes about how simple the process is? Because I've heard a lot, and everybody goes, well, you got to go to one doctor, and he's going to cut you open. Then you go to another doctor, you got to do this, and then you got to wait for that to heal, and it's simple.
No, a lot of times I'll have 2 or 3 implants in, and they're like, "That's it? You're done?" I'm like, "Yep, that's it." And I'm try not to downplay it when I'm explaining it to them, but I'm like, it really is that easy, and they don't know until they go through it. But yeah, it really is that easy sometimes.
Come on, give me a little love here.
Float up.
Freedom Mini Dental Implants. Give them a call today for a free consultation. We'll be right back on Wave 3 Listens Live.